So, a very good evening to all the eminent doctors. Thank you for joining us for the today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an initiative from Cadila through its innovation to serve the society's humankind. The topic of the webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear Doctor, Rabies is the world's first novel three-dose anti-rabies vaccine, and with great pride, we'd like to inform you that Rabies has successfully completed 1 year of launch. With more than 40,000 animal bite victims being vaccinated, 100% compliance was recorded, and no case of ADR was registered. With this, it's my honor to introduce you to the speaker of today's webinar, Dr. Ria, a renowned doctor of Abor. Now, I would like to request Dr. Ria to initiate the talk, and later on, we have a discussion on this Travis. Thanks, ma'am. Please start.
Thank you, Mr. Vishal, for your nice and warm welcome. I
Thank,
have been invited by Candela Pharmaceuticals to give the topic. My topic for today is rabies vaccination to give awareness about rabies. So we are going to start a webinar with the headline of Novel 3-Dose G Protein Vaccine, Ultimate Key for Compliance. We'll talk about rabies, that is a very deadly viral disease that we all know. Every 9 minutes, a person dies from rabies, right? Rabies is a public health challenge in India. Globally, nowadays, we can see 59,000 human deaths annually. That is highest in India. India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths only in Asia and 35% globally. We can see 35 among 35% globally, 60% of the rabies deaths are in Asia. 91% deaths in India occurred in rural areas. As we can see, rural areas, they are unaware about rabies virus and its cure. So it's our duty, it's doctors' duty to make them aware. So I would just, it's a warm request to all the doctors, whosoever come to you for a rabies vaccine, or whenever they talk about you, है ना, so you just have to share your feelings and just try to help them out, as they're unaware. Everybody, now we can see a person comes, so a rural person when comes, he'll say you ki ਅਸੀਂ ਜੀ ਮਿਰਚਾਂ ਬਣ ਲੈਨੇ ਆ, ਏਦਾਂ ਕਰ ਲੈਨੇ ਆ, है ना, तो we are the one, we know it, that doesn't work for us, right? So it's our duty, it's my humble request to all the doctors that please make them aware about the vaccination program and the treatment protocol. So current management, what we do when a person or a patient come to us, as we know, we do local wound treatment, first aids. We have to give active immunization in the form of vaccine. That Candila Pharmaceuticals is providing us 3-dosage vaccine on, we can give on 037, that we all know. And also we have to give passive immunization with rabies immunoglobulins, right? So we can see sometimes the 5 days, we give 5 days dosage, that is 5 dose, 0, 3, 7, 14, 28. So what happens, that is sometimes non-compliant. Why they are non-compliant? Because sometimes people are not aware that they come to us and they'll take 1 dose. They don't want to, they don't say कि हाँ we'll take 5 dose, or they, सबसे बड़ा problem ये है कि they can't remember the days. 037, they are unaware about it. They say आज ही ला दो सारियां, इस तो बाद नहीं आया जाना, साडे कोल time नहीं हैगा. So we have to make them aware that this is for your betterment only. So what this company has done, Candela, instead of the 5 dose, we can reduce it to 3 dose. That is why that is easier for us also, and also to the person, to the patient to come to us. So complaint is who received the course of ARV, that is the scheduled dose of ARV on the recommended dates. Delayed complaint is the main problem. Who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen, right? So some companies and some universities have just like made a chart or scheduled. So they have gave an outcome that even if we give 3 dose vaccine, but without rabies immunoglobulins, there are death rates within 15 days or 7 days or immediately. So with this Candula Pharmaceuticals 3 dose regimen, this gives us enough immunization immunoglobulins that give a good compliance to vaccination. So in a survey, we saw that within 100%, we can see on the screen. I don't know how to do that. Chalo, anyhow.
1 second, ma'am. 1 second. Sorry to interrupt you. I'll request your technical support to share the this PPT so that all the doctors can see. Wait for only 1 minute.
It's okay. I just here we can see. It's okay, sir. No need.
Okay.
I hope you all can see.
Yes, 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 ma'am. It's
These
okay.
are the constraints. These are the main constraints that we feel in the field. What is here? We can see the chart. The main is loss of wages. Many people of rural areas and even urban areas also, many are not even enough literate to understand this problem. They are thinking that this is just a waste of money to give 5 days vaccination. They think 1 day dose or just 1 day can give them relief. That is not correct, right? So in this chart we can see, first of all, the main reason is loss of wages. That is the very main reason in rural areas and also in urban areas. We can't say this is the problem in rural areas only. In fact, in urban areas also, this is a very major problem. So loss of wages 41%. That is interference with the school timing. They say we have to go to the school. People are actually, these are the same timing of the civil hospital, same timings of the school. So people are not that aware that this is a very important program. So distance of the hospital, कोई नेड़े तेड़े कोई हस्पताल है नहीं जी, ਅਸੀਂ ਕਿਵੇਂ ਲਗਾਈਏ vaccination. This is a very common problem of people. Cost incurred, forgotten dates, that we have discussed earlier also. Ki this is the main problem. Even we can't remember actually. If I get bitten by a dog, then I also, it's very difficult for us to remember the dates 037 on which date I have to mark on my calendar. I am a doctor, that's why I have to keep this in mind. But how can we expect ki for 5 days or for 21 days a layman man can remember the dates? No, that's very difficult to say. I mean, if I have been bitten, I will also mark on my calendar that these are the dates actually, because I know the importance of the vaccination, these 5 days regimen. So how can we expect the layman to remember all the 5 dates? No, that's not feasible. That's not feasible. That's not practical thing that we're talking about. So what we are thinking, that why we are focusing on this 3 days novel 3 dose, because we know it's very difficult to remember the 5 days or 21 days. So we are just just we are trying to just decrease that probability. So we can at least, this forgotten dates we can decrease by some percentage at least. Loss of wages, we can decrease the dose to 3, so that the 5 dose, the cost of 5 dose is not that. So the evolution of rabies vaccination we have seen in recent years, in 1885 to 1911 to 1976. In the earlier times, people used to say, ਪਿੱਛੇ ਹੱਡੀ ਚ ਰੀੜ ਦੀ ਹੱਡੀ ਚ ਲੱਗਦਾ ਸੀ ਟੀਕਾ. Nowadays it's very easy. Some people are very furious now also. They say if a dog will bite you, they will give you injection in your spinal cord. No, that's not true. Science has improved very much, and it's very easy nowadays. Nowadays I have heard many people saying ਢਿੱਡ ਚ 3 ਟੀਕੇ 21 ਟੀਕੇ ਲੱਗਣਗੇ ਜੀ. We are very furious. Rabies ਦੇ ਹਲਕਾ ਦੇ ਟੀਕੇ, ਪੇਟ ਚ ਟੀਕੇ ਲੱਗਦੇ ਨੇ. So we have to make them aware that this is not the case. I myself go to schools. I myself go to many camps and make them aware ki no, this is not the case nowadays. You need not to get pet mein teeke. No, it's not. It's very easy to get vaccinated, especially with this newly launched 3 days regimen that is very compliant. So this is the Candela Pharmaceuticals is meeting the unmet medical need. So they are introducing a novel vaccine with simple and shorter regimen, that is 3 day regimen, not 5 days. So what is different about this novel 3 days recombinant rabies G protein vaccine? The main important thing is this is prepared by VLP platform technology. That is, ठीक है, this is provided by VLP, that is virus like proteins, that will discuss how this is produced. This is first protein subunit vaccine, first vaccine with 3 dose intramuscular regimen, as we have discussed earlier. Not टिच टीकन नहीं लगनगे, spinal cord which टीकन नहीं लगनगे, read the हड्डी टीकन नहीं लगनगे. It's very easy intramuscular regimen, that is 3 dose 037 days. Better compliance due to easy to flow regimen, less visits, less cost, and it's very convenient to remember 3 days as compared to 5 days. So now we'll see how this is made. Okay, just 1 second. Okay, I hope you all can see the screen. Okay, this is native virus with the viral genome. G protein is very difficult to stabilize. So what this company has done, this produce virus-like particles. Our protein complexes exist as nanoparticles. So VLPs, what are VLPs? Virus-like particles are similar to native virus particles, but that do not contain the viral genome. They cannot replicate, but they can mimic the viral antigenicity. So what they do, that we all know, the viral genome, without viral genome it cannot replicate, right? So the virus will not replicate, but with that protein, with that boundary, your body will can recognize the virus and it will produce the stronger humoral and cellular immune response. So VLPs can be used as vaccine, so it can be very safely used. Novel 3 dose was non-inferior to reference vaccines, less adverse effects, and it is found to be safe and immunogenic as compared to all the 5 doses of WHO pre-qualified vaccines. So the awards of Candela Pharmaceuticals is Pharma Innovation of the Year by Economic Times, the Golden Globe Tigers Award Malaysia for Innovative Product of the Year. This was the presentation by Candela Pharmaceuticals. Thank you so much.
Thank you so much, ma'am, for your informative talk. We truly appreciate your efforts. Last
Thank
but not
you.
like to inform you, Rabbis has won two prestigious award, ma'am. Is in innovation
Okay.
category, Indian Pharma Award and Golden Globe Tiger Award, ma'am.
Acha,
So
acha.
I'll request again to you use Thrabis as much as you can.
Sure, sure. We are.
Patient compliance is there, and the main thing is the scheduled dosage. It's less
Hmm.
than it's reduced 28 to just 7 days to
Hmm.
complete therapy. So once again, I'll really thank you for giving the Kerala precious time. Thanks so much, ma'am. Have a nice day.
Thank you.
Thank you.
Thank you.
Thank you.